Hi everybody, Debbie Moore here. For the last few weeks you've probably seen me here with Jeff Pruitt from Partnership for Community Care, and we've been talking about different aspects of drug addiction and drop boxes and all kinds of things. So today I have Dr. Mark Mattioli here with me, and we're going to be talking about Project Lazarus as well as addiction. And I'm talking addiction to prescription drugs, to drugs that were obtained legally for the most part. So, Dr. Mattioli, welcome.
Thank you.
Tell me a little bit about the history of opioids and how and why someone would become addicted to them.
Well, these drugs were originally designed to help treat people who had terminal illness, cancer, and other severe forms of pain. And the initial research really didn't look at the long-term effects of using these drugs for years. It was mostly months, and most people didn't last that long, so unfortunately they died before we got to see them have any addictive nature. What happened is, since these drugs work so well for pain, it was decided to use them for all sorts of pain that people have, and now we're finding that when you are on these medications for an extended period of time, you can develop an addictive type of situation with them, whereby you need more and more medications in order to receive the same result. And consequently, many folks are now finding themselves addicted to these medications where they had no intention of doing this. They had no history of substance abuse. They're not substance abusers. They're not interested in abusing drugs, and yet they find themselves in a very awkward position.
Do you think sometimes doctors tend to prescribe something stronger than is really necessary?
That can sometimes happen, and also with the fact that doctors seem to spend less and less time with their patients now than they used to due to all the constraints that they have with patient loads and insurance issues and how much time they really have available, there's a tendency perhaps to maybe just prescribe to get the person the medication they need and then see how they do, and then they'll come back in a few weeks and then renew the medication again. So they may not be spending as much time as they need to with these patients to go over these medications and how to get them to use the least amount possible to treat their pain.
Absolutely. So the unintended consequences of long-term use of opiates is addiction.
In many cases it is, yes. And unless the person has incredible self-control and manages these medications appropriately, they can very easily become addicted after they've been on them for 6 months.
Right. Project Lazarus is not about substance abusers, but more about pain patients.
Yes.
And who begin to look like substance abusers. Walk me through that.
Well, because a lot of folks, we have our opinion of what substance abusers are supposed to look like, the type of individuals that they are. What happens over time is as people become more and more addicted to these medications, they become more desperate, and they'll go back to their doctor and they'll be asking for medications more frequently. Their doctor will not be able to refill them and say, no, I'm sorry, I can't do it. I just did it last week or the day before yesterday.
Right.
And they end up having to go to other areas outside in the community, or maybe show up in an emergency room, and then those in the emergency room might anticipate that this person, well, are they a substance abuser by just the way they present themselves, or is this someone truly in pain that actually needs more medication?
Well, tell me how Partnership for Community Care can help these people.
What we're trying to do is work with the community, work with physicians that prescribe these medications, work with patients, and get them to talk to their patients, get their patients to talk with them, let them know how they're doing on these medications. And we also provide a lot of services where we can go into the home, sit down with these patients, look at their medications, see what they're taking, what they're not taking, and communicate with their physician to let them know how well their compliance is. And perhaps we can avoid a lot of the unnecessary problems associated with these medications and addiction.
Absolutely. Do you have any last words for us today?
Well, just in terms of safety, that people should be very careful with these medications. They shouldn't share them with their friends or their relatives. And we have drop boxes around the area and the community to get rid of.
We've had them on the screen right here. This is the new one that was just set up at the Sheriff's Office here in Rockingham County.
Yes. And just if they have questions about their medications, to discuss it with their doctor before they make any changes or do anything.
Thank you, Dr. Mattioli. I
Thank
appreciate you being here today. All right, folks, I hope we have helped explain a little bit about how some people actually become addicted to medication legally. And I know that sounds crazy, but it is. It's a legal addiction is what has actually happened here.
Yes.
So if you need help, get in touch with Partnership for Community Care, get in touch with your doctor, just get help and get rid of the drugs. Go drop them off somewhere. Don't get into mom and dad's drugs. Don't get into grandpa's drugs. Get rid of them. Get rid of them. Get rid of them legally. All right. Thank you for being with us today. Thank you, Dr. Mattioli. And I'm Debbie Moore reporting for Star News.